You can start.
Hello everyone and a very good afternoon to you all. Myself Solu Gautam and today on behalf of Mero Eye team, I'll be hosting the current session and I extend a very warm welcome to each one of you who have been connected with us through our iTalks webinar. Also, I would like to thank you all for taking the time out from your heavy schedule and marking our program with your glorious presence. Thank you for joining with us this afternoon and also don't forget to subscribe our YouTube channel so you can always be in touch with our programs even in the future. For now, I would like to step forward to inaugurate today's session and also I would like to notify you all that we will be having our discussion session at the end of the webinar. So if you get any queries in between the session, then just drop it on our comment section. We will get back to you later on. Today, as a speaking delegate, we have Dr. Akshay Badakere, who will be talking on topic visual milestones in children. Before he begins, I would like to give his general introduction. Dr. Akshay is a fellow of the Royal College of Surgeons and an assistant ophthalmologist at Childsight Institute, Justi V. Ramanama Children's Eye Care Center, LBPEI, Hyderabad, India. I welcome you, Dr. Akshay, on behalf of Mero Eye Foundation and all our participants.
Thank you. I'm really privileged to get this opportunity and to have a chance to talk to everyone.
So now you can begin with your presentation, sir.
Sure. I'll just share my screen. Yeah, so hope I'm audible and my slides are visible.
Yeah, it is.
Yeah, thank you. So first and foremost, I'm really thankful. I'm thankful to Mero Eye for giving me an opportunity to speak here. And I think your coordination with me to get this class through was really good. You've been very helpful to me and very accommodating. So let me briefly tell you, I'll be talking about visual milestones in children. It's an extremely important topic for all of us, whether we are optometrists, ophthalmologists, need not, I mean, it's not just for pediatric ophthalmologists or pediatric optometrists, it's for all ophthalmologists and optometrists. And I'll tell you why. Okay, so with that brief introduction, let me begin. Now, when babies are born, all babies are born with a complete visual system. Okay, but they must learn how to see. So vision actually is a skill that children develop over a period of time. And a child's vision develops throughout their first year of life. Okay, so a lot of times babies may be brought to you as optometrists or ophthalmologists, just as doctors. Parents may bring their children saying, doctor, or sir, our child is not able to see. We have to be very careful when we tell them that their child may not be able to see, because often we may be wrong. It may be that we're testing the wrong way, we're using the wrong test, we're looking for the wrong milestone. And that is why knowing visual milestones in children and at what age they get these milestones is extremely important. So remember, whenever you see a child who is visually unresponsive, okay, if the child is very healthy but is visually unresponsive, it's an alarming finding. As a parent, as a doctor, as a relative, as a friend of the family of who has this child, it's a very scary situation for us. Parents obviously will be anxious. They'll want to know what is the cause of the visual unresponsiveness, what is the severity, what is the prognosis, is there any treatment for it. They'll have all these questions very naturally, and as ophthalmologists and optometrists, we need to address these questions. Okay, and we have to keep in mind that depending upon the underlying cause, the visual outcome may vary from normal vision or to complete blindness. Okay, and that is the differentiation that we have to make. If we open any standard textbook, it tells us that the important visual milestones are these. So from 0 to 2 months, they can develop a pupillary response. They learn how to fix and follow objects. Their saccadic eye movements are maturing, which are initially jerky, then they become smooth. Most children can be born with an exotropia or an outward deviation of the eye. Over a period of time, they learn how to fix it. And by 2 to 6 months, they learn how to centrally fix and follow. So they can watch the mother's face. They develop accurate binocular smooth pursuits. They have something called a monocular smooth pursuit asymmetry. That is, the temporarily directed saccades are slow, but when they direct it nasally, it can be a little jerky. And within few months, they develop orthotropia. So I told you that most children are born with an exodeviation, but by the age of 6 months, they should be orthotropic. Okay, but are these the only important visual milestones? No, these are just a few. There are a lot many more that we need to know, and I'll be highlighting those. So let me go one by one. Okay, now I have identified 8 crucial milestones which I want to be talking about, and I'll take you through what these milestones are, why is it necessary for a child to develop these milestones, what should a mother look for, okay, and what should we do. Okay, so these are the 8 crucial milestones, the crux of my talk. The 8 crucial milestones to be attained by the age of 1 year. Okay, the first one is the ability to make eye contact. This is followed by a social smile. Once a child develops a social smile, they develop a milestone called awareness of hands. Then they're able to watch hand movements. Following this, they develop orthotropia, like I said in my previous slide. They develop goal directed hand movements. They begin to recognize familiar faces. And by 1 year, they're able to identify pictures in a book, or they're able to pick up objects. Okay, so in sequence, these milestones develop. So the first one to develop is an ability to make eye contact. And by 1 year of age, the last one they develop by 1 year of age is they can identify pictures in a book and they can pick up objects. These are extremely simple things that we can look at, and I'll explain how we can look for it and help not only the child but also the mother. Okay, let's go to the first milestone, that is stable eye contact. Okay, a child should be able to make stable eye contact immediately at birth, but no later than 8 weeks. Okay, so from birth to 8 weeks, they should be able to make a stable eye contact. Now, what does the stable eye contact mean? Stable eye contact means that when awake and alert, when the child is awake and alert, they are able to hold their eye contact. So if the mother is holding them in their hands, or if a caretaker is holding them in their hands, the child's eye should be fixated on the face of the caregiver. Okay. Well, now what is the importance of this? Remember, babies have an innate attraction for faces, especially smiling faces. You'll see that if a child is looking at you, you smile at it, it continues to look at you. That's because they like to see smiling faces. Okay. So when the baby looks at the caregiver, in this case, say the mother, it creates pleasant feelings between the baby and the parent. It's also an important sign to develop bonding and communication between the mother and the baby. So what happens if the child is not able to make eye contact? Okay, it actually, when the child cannot make eye contact at this young age, it can not only, visual aspect is one thing, maybe the vision is affected, but apart from that, it can affect the emotional and general development of the child. That is the importance of these milestones. Okay. So what are the questions we are supposing a child has been brought to us? Say I am an optometrist and a child, my relative has brought the child to me saying, my my baby doesn't make eye contact, what are we supposed to do? So what should we do? Refer this child to a primary care physician. Okay, so that the primary care physician or an ophthalmologist can do a complete eye examination and refer if necessary. Now if the vision is found to be age appropriate, educate the parent on communication skills. So what does this point mean? It means that if the child is not making eye contact, it may not be that the child is not able to see. It may be that the parents have not yet learned how to communicate with the child. Maybe young parents, first time parents, anxious parents, they don't know how to communicate with the child. So they have also, parents should also be taught how to communicate with the child. Okay. Apart from this, the child may need some early intervention services to help develop sensory and motor functions. What can we do? Some simple tips we can do is tell the parents to hold the child close to the face and talk. So when they do this, the child slowly starts looking at them and it helps them build stable eye contact. We just spoke about eye contact. Now the second one. The second one is something that I think warms all our hearts, isn't it? Social smile. When we see that baby smile for the first time, it melts our hearts, whether we are parents, whether we are the uncle and aunt of the child. As soon as the child smiles, it melts our heart. Okay. So this happens between the third and fourth month of the baby's life. What is the importance of this milestone? It tells us that the brain and the visual system is maturing. Accommodation is developing. So the child is now not only able to see a near face, like a face of the parent, but also at intermediate distance, it's able to identify. So that accommodation is developing. It can, as I said, it can see clearly at varying distances, and it's a new skill that a child has gained. So we know that, the visual system, the central nervous system, all this is maturing as the child is growing up, and hence it has acquired a new skill. So now what if the when the parent approaches the baby, does the baby respond with a smile? This is what we need to ask. So supposing a child has been brought to you and the parents have a doubt that the child is not able to see, ask them this question. What was the first question? The first question is, does the child make eye contact? That is the first milestone we covered. The second question we need to ask is, does the baby look at you and smile? Okay. Now, if the baby is not looking at the mother and smiling, then it needs to be referred to a pediatrician and an ophthalmologist for a complete examination. As I said, supposing there is a lag in these milestones, it may not always be a problem with the baby. Maybe the mother has to be taught some communication skills. So we can also do some early intervention to help the mother communicate and improve her communication skills. Also, it may be that the mother is having some emotional or physical health issues. So these emotional and physical health issues need to be assessed and treated. Once we do that, automatically things fall in place. So having spoken about social smile, let's go to the third milestone. The third milestone is awareness of hands. What do I mean by awareness of hands? Awareness of hands means that the child will keep moving its hand in front of its face, or it will take its hand and put it in its mouth. We have all seen babies doing this, right? So this is again a very important visual milestone. Why is it important? It tells us that the hand and eye coordination the child is developing and its visual conception is building. So it knows that it is able to see objects around it. It is taking interest in seeing things. It's taking interest in its own hands. Okay, so this is the importance of this particular milestone. So now what do we do? How do we ask for this? We need to ask the specific question. Does the baby watch her hands? And does the baby bring his or her hands to midline and to its mouth? So midline means it's waving its hands around, then brings it on its chest, and then from chest it goes to the mouth. So these are the two questions we need to ask. Supposing the baby is not able to do this, baby is not watching her hands, not taking it to her mouth, then the possibilities are that the child may not be able to see his or her hands at all. So a vision assessment needs to be done. Apart from this, it could just be that the baby doesn't know. So what we should do is we should encourage the mother to actively move the child's hands to the midline and then to the back. And we can refer the child for some early intervention activities which can help hand-eye coordination. The next important milestone that we need to talk about are watching of hand movement. So what was the earlier one? The earlier one was awareness of hands. So awareness of hands, I told you, was that it tends to move its hands around. It may bring it to the midline. It may bring the hand to the mouth. Okay, and we spoke why this is important. The next one is, does the baby watch his or her hand movements? And if you see, they'll start mimicking the movements done by adults. So if the adults say, if they wave their hands to say bye, even children tend to do that. They tend to copy these movements. Okay, so this fourth milestone of copying the movements of adults is an important visual milestone again. Okay, so if you realize in my talk, I have spoken about visual milestones, but a lot of these milestones also have to do not just with the eyes, but other parts of the body as well. Like we spoke about the hands, bringing the hands to the chest, to the mouth. So that is the importance of vision. Vision is not just being able to see something, but also to be able to what we call as a functional vision assessment. Okay, where they are able to move their hands, get hand-eye coordination. All these are important aspects of visual development. Okay, so coming back to watching of hand movements, the importance of this hand movements are that we know by this that the child has developed an ability of goal directed movements. Okay, it is beginning to learn by imitation, and it is able to understand what others are doing. So it's able to understand the actions of what the adults are doing and what is the meaning of these actions. Okay, so I hope till now everything is clear. We covered 4 milestones so far. Let me go to the fifth one. This is self-explanatory. If you look at this picture here, this child is fixing with the right eye, but has an inward deviation or an esotropia in the left eye. Okay. So the fifth milestone, by the age of fifth month, the eyes should be straight. A child's eye has to be straight by the fifth month, and it should not appear to either deviate out as an exotropia, or there should be no inward deviation like an esotropia. Okay. And why do we need straight looking eyes in a child? Because this is important for binocular vision to develop. Okay. So what questions will we ask as primary care physicians, as doctors, or as optometrists? We'll ask the parent, are your baby's eyes straight? Do they appear to drift or cross at times? Okay. If the parents say yes, sometimes I feel that the child's eye tends to drift out, or the child tends to keep the eye towards the excuse me, towards the nose, immediately this child has to be referred for a detailed ocular examination. Okay. When I spoke about the fifth milestone, I briefly spoke about how when a child is able to watch his or her own hand, it is developing goal directed hand movements. Okay. So now let's discuss the sixth milestone. The sixth milestone is the child developing goal directed hand movements. Okay. Now what does goal directed hand movements, and when is it supposed to develop? It is supposed to develop between the 6th to 7th month. Okay. So you can see here in this picture, there's a ball. This child is going towards the table and reaching out to the ball with his hand. Okay, so that is goal directed hand movement. It sees some object, it is interested in that object, it walks towards that object and stretches out with its hand to grasp that object. This is called a goal directed hand movement. Okay, and why is this important for us to ask and important to know if this milestone has come? Because it tells us that the child is developing interest and curiosity. These are two important elements for the child's overall development. And remember, if the child is not doing this, if it is not showing interest in objects, if it is not doing these goal directed hand movements, it may be an indication that the child is not able to see. Okay. So what should we do in such a case? As I said, it is time to get the baby for a complete eye examination. Okay, so a detailed cycloplegic refraction and examination and a retinal examination needs to be done. So we spoke about goal directed hand movements. Now let's talk of the next milestone, milestone number 7, that is an ability to recognize familiar faces. Okay, this normally develops between the 7th to 9th month, so it can vary sometimes. What is the importance of this milestone? Now, say by 7th month or 9th month, the parent comes and tells you that, doctor, my child is 7 months old or my child is 10 months old, but he just cannot recognize family members. Okay. So there are three important things to this. One, it may be an indicator of social and visual development. So vision development may not be happening like it should happen, or the child may not still be developing has not yet started developing its initial that social skills. Okay. And it's a supposing they tell you that not only this, but the child always wants to be carried by me. It's very clingy, doesn't leave me at all. I have to carry it all the time. This is again a red flag. Okay. So a child by 7th or 9th month normally is independent. It'll keep crawling or walking around all over the house. If it doesn't do that, it wants to be carried all the time. For us, it's an indicator that the child is scared. It's scared because it's not able to see. Probably it's tried to walk once or twice on its own, banged into something, got hurt. So it's now all the time clingy. So remember this, by 7th to 9th month, if the child is very clingy, doesn't want to get down from the parent's lap, or if the mother or father is holding it, it doesn't want to get down and walk around, again, it's a sign that probably the child is not able to see properly. So again, such children have to be referred for a complete examination. An ophthalmologist should do a detailed cycloplegic refraction and retinal evaluation. Apart from that, also, if you have a pediatrician attached, send it to the pediatrician. The pediatrician can assess for the social milestones and those things, because they are also equally important. Okay. As I said, remember, if these milestones have not come in children, sometimes it may not be in there may not be a problem with the child. It can also be with the parents. So supposing the parents are overprotective, they have not let the child down, not allowed the child to walk at all with the fear of the child getting hurt. That can be one problem. So if you send it to a pediatrician, the pediatrician can assess and tell the parents that your child is absolutely fine, let him walk around. So that is also important. So each of these milestones we are covering, what are the aspects of the eyes that need to be checked, and parents also need to be educated. So remember this. Let's come to the eighth milestones now, that is looking at pictures in a book or picking up objects. Typically by the age of 9 to 12 month, if you have seen children, they'll start showing interest in books. You give them a book, they'll start turning pages, they'll start pointing out to things in the book. Or sometimes what happens in India, sometimes introduction to books might be little later. Okay, in such scenario, you ask the parent whether the child goes and picks up things with a thumb and index finger. So if the child is able to pick up, say, a small grain of rice or a small rubber pellet that has fallen on the floor with the thumb and index finger, then it is the same. So whether the child is seeing pictures in a book or it is using its thumb and index finger, what we call as the pincer grasp. Pincer grasp is using the thumb and index finger to pick up objects. It's the same milestone number 8. Okay, very important milestone again. You can see here it's pointing out to pictures in a book. What is the importance of this milestone? It tells us that again, hand-eye coordination of the child is good. It is able to identify different distances and pick up objects or turn pages from a book. Its vision is sharp and clear, keeping its age in mind. It is able to connect gestures and pictures into words. Okay, so if once it looks into a book, it may point to some animal or something. So it tells us that this child is now beginning to comprehend that picture. Okay, and also tells us that the emotional development of the child is happening normally. Okay, so through all these milestones, I'm just repeating my point. Through all these milestones, it not only tells us that the child's eye is, whether it's normal or something is not normal, it also tells us how is the child developing emotionally, socially, and in turn also tells us whether the parents need to be trained in something. Okay, what are the other milestones now? We spoke about milestones till 1 year of age. We spoke about 8 milestones. Okay, important to remember in these 8 milestones, I'll just reiterate again. Remember social smile. Social smile tells us that at different distances the child is able to now recognize, so the visual system is good. Or it may be that an emotional bond between the mother and child has not developed, or the mother has some health or stress related issues which needs to be taken care of. We spoke about goal directed hand movements and the importance of goal directed hand movements. And the last milestone I spoke to you was whether the child points to pictures in a book or whether it is able to pick up objects from a floor using its thumb and index finger. Okay, and we said that the importance of this is hand-eye coordination, accommodation, developing, emotional development. Okay, so till 1 year, there are these 8 milestones. Okay, what are the other important milestones? Now, by 18 months of age, if you are able to test on pediatric acuity cards, then the vision matches that of adult acuity. Okay, so you have a 20-year-old, say a 25-year-old adult, you're checking his vision on a logmar or on a Snellen's, and you're checking an 18-month-old using pediatric acuity cards. Okay, you have your Leah cards, Leah symbols. If you check, then you'll actually be able to match the two. You'll be able to compare. Okay, by 3 years of age, they are able to match adult values on Snellen's acuity, and their contrast sensitivity develops well by 3 years of age in children. Okay, and by 5 years of age, their stereopsis is fully developed. So remember, binocular vision we can test by 3 years of age. You can start looking, sorry, by binocular vision, you can start looking by giving them stereo acuity books by 5 years of age. We may have to put some effort to train them how to identify those pictures in a stereo acuity book, but it is possible. So with that, I'm concluding my talk. Thank you very much again. Thanks to Mero Eye for an opportunity. And if anyone has any questions, I'm very happy to take them.
Thank you so much, Dr. Akshay, for your time. Now we are to move to our discussion session. Are you ready to take the questions, Doctor?
Absolutely. Yes, I'm ready.
Okay, let me check out the questions that our attendees might have raised. Okay, there is no any questions till now. If you are having any queries, then you can come up with your questions on our chat box. Dr. Akshay will be happy to clear all your queries. Okay, we have a question by Ajay Sa. Thank you for your questions, Mr. Ajay. How can visual acuity be recorded in abnormal child like having any Down syndrome, etc.?
Okay, thank you. Very important question. Thank you for that question. Now, supposing you have a child, I would just reframe that question. See, no child is abnormal. A child with Down syndrome also is a very special child, and can, it's very important to take care of these children. Okay, so how do we test for vision? Now, remember, visual assessment depends upon the age of the child. Okay, so if the child is say a year old, then you might have to start using teller acuity cards to check vision. A little older, by the time they are say 18 months or 24 months of age, you have pediatric acuity cards, you have Leah symbols, you have Leah gratings which you can use. So there are different testing methods that are dependent upon the age of the child. Okay, now supposing this child with Down syndrome is children with Down syndrome will have some amount of intellectual impairment also. Okay, and along with that they also have issues related to their accommodation. So we need to remember these two things. Let me tell you why. Now, because they have a little bit of intellectual impairment, remember, you may not be able to assess their vision using the same test that you would do for a child without Down syndrome, without any intellectual impairment at around 3 years of age. Okay, so you might have to use some simpler methods. You might have to train the parents to teach them symbols at home and then call them back and test using Leah symbols. Okay, and children with Downs can have issues with accommodation. They may have hypo accommodation. So it's very important for these children you do a good cycloplegic refraction and look for refractive errors, or you can do a dynamic retinoscopy also, which helps you to enable whether they which helps you to know if they have any difficulties in near and intermediate distance. So for a child with Down syndrome, remember these two important things: tests to be selected based on the age of the child. If there's intellectual impairment, you may need to use tests that you would use in a much younger child. Even though the child may be 3 or 4 years of age, you may have to do a teleacuity cards to check. And you can ask questions about functional vision, exactly what I spoke about these milestones. So ask the parents whether this child at home, remember, a child in clinic will be a little scared seeing so many of us wearing a white coat. They associate white coat with the pain of injections. So you ask the parents, is the child able to eat on his own? Does he walk around avoiding obstacles at home, or does he go bang into sofas? You know that if he walks around avoiding obstacles, he has good vision, he's able to not hurt himself. If he eats on his own, you know that his near and intermediate vision is good because he's able to hold a spoon, pick it up, and put the food in his mouth. So these are important questions that you need to ask. So that's why I said that these milestones which we discuss now are extremely important, because vision assessment is not just having a chart and having the child read from the chart. Because as you very nicely asked in this question, a child with Down syndrome or a child with intellectual impairment, you may not be able to do these tests. So these sort of questions, whether they're able to eat on their own, whether they're able to walk around at home avoiding obstacles, do they recognize the parent's face, they are very important. So all these, in short, for your question, an answer would be a combination of all these things. Tests depending on age, simpler tests or maybe tests for younger children if there's intellectual impairment, good cycloplegic refraction, and questions on functional vision, which I just mentioned.
Okay, thank you for your answers, Dr. Akshay. We have another question. In delayed milestone children, apart from visual acuity and stereopsids, what else can be assessed in clinic for child's development, whether it is improving or not?
Thank you for that question. Now, a child with delayed development. Okay, when we say delayed development, there are multiple aspects in it. One of the important things we need to keep in mind is whether neck control of the child has developed. Now, remember, children are able to hold their neck and head straight by about 3 to 4 months of age. If they are not able to do that, it's a little difficult to do a teller acuity card testing because their neck keeps flopping, their head keeps flopping to one side of the shoulder, and you may not be able to do the test properly. So some small things, simple things you can do. One is you take a torch. In fact, the first test would be you take a torch and put it on their eyes. They'll blink. Okay. If they blink, what we call as the dazzle reflex, you know that the child has vision. You can reassure the parents that the child has vision. Next, you take a toy, take an illuminated toy and just move it in front of their face. You'll see them following that toy. So that's another way of telling that the child can not only see stationary objects, but it's able to see moving objects. Okay. And from there, you slowly start building. So ask the parents, does the child crawl? If he's crawling, does he avoid obstacles? When he's crawling on the floor, is he able to pick up small toys from the floor? Again, as I said, these are all indirect indicators that the hand-eye coordination and the vision is developing in a child. So supposing you have a child with developmental delay, they've come to you the first time they've come, parents tell you that he doesn't see our faces. You check the dazzle reflex is there. So you reassure the parents, tell them that when I throw light, the child is closing its eye. That means it's able to identify light. We'll do some early intervention services, some visual rehabilitation will provide the child. You send them to a visual rehabilitation center, or you teach them some simple things at home. Like I said, hold the child close to the mother or father's face and make them speak to the child. You can put in a cradle, you can put some illuminated objects and move the cradle so that when the child is sleeping, it can see those colorful objects moving. Do this for some period of time, and then when they come back to you, ask them whether now they are able to identify the parent's face. Are they able to crawl? If they're crawling, are they able to pick up objects from the floor, or are able to point towards a toy? So these questions are ways of making sure that the child's vision is improving and also improving the morale of the parents. So remember, parents will naturally feel very upset if they realize their child is not able to see. So if you ask these questions and the parents tell you that, yes, doctor, my child now was earlier was not crawling at all. Today it's crawling and picking up some small toy. So you can tell them, see, if it's picking up a toy, that means it's able to see now. So its vision is improving. So these are the ways to look for visual improvement.
Okay, thank you for your answers, Dr. Akshay. These are only the questions that have been raised by our attendees till now.
Sure, sure. Very
We,
nice
we
questions.
will be we will be waiting for just a few minutes if anyone is willing to ask.
Sure, sure.
Okay, Dr. Akshay, we have another question by
Yes,
Azaz
please.
Saha, but it is of color vision. In a small child, how can color vision be assessed?
So it's a little difficult to assess color vision in a very small child because it depends upon how early has the child been put to school. So it depends on a lot of things. But in general, by around 3.5, 4 years of age, you can assess color vision in the child. So you may not be able to show it a color vision chart or an Ishihara's chart and assess color vision, but you can certainly do some things like you can take we have homemade drops. So show the cap of the drop and ask them, what color is this? You can take a red colored object and say, what is this? What color is it? Is it a ball? If they answer correctly, which color ball is it? Like that. Or you get a toy with, you get this football with multiple colors on it. So green, blue, red. So show them that toy and ask them to name the colors. That way you can check, because the reason we have to use such simple things to check color vision is because, as I said, many times children are scared. What happens is, say a 4 or 5 year old child has come to your clinic, parents are there. Many times they think that they are facing some exam in school, and they're very scared of telling the wrong answer, so they don't tell anything at all. So then either we or the parents become little apprehensive that the child has a color vision problem. So when you're checking for color vision in a child, in a young child, make it like a game. Show them a ball, show them some cartoon, ask them, can you see that? What color is it? Then they will answer properly. So by 3.5, 4 years of age, by 5 maximum, you can safely check color vision in children. Below that, it's difficult, but definitely above 3.5, 4 years of age, it's possible if we involve play like this. We make it like a play.
Okay, thank you for your answers, Dr. Akshay. We have again another question by Mr. Ananta Paudel. Thank you for your questions, Mr. Ananta. The question is that is CSM a scientific method of recording or presenting visual acuity?
So sorry, I didn't get the is what a scientific method?
Central Steady Maintained
Yes, yes.
CSM.
Yeah, yeah. Yes, 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 yes. It is. It is. Central, very nice question. Central study maintained is a very, very important test to look for, to check for vision in a child. And it is a scientific method. It definitely is very, very important. It gives a lot of information. Central means it's able to hold that, it doesn't have a squint, it's fixing, it's using its fovea to fix. Steady means that it's not having any nystagmus or something, and maintain means it's has good fixation, it's able to retain its eyes on the object of interest. So definitely it is very, very important.
Okay, doctor. These are all the questions, and I want to add one question to you. Okay, how to assess malingering in pediatric population?
Yeah, nice question. Very common thing we see, especially when we see malingering in two situations very commonly in the pediatric age group. There are many situations, but the two important ones we see is, we see them just before exams or just before exam results in children, or supposing there's a child and the parents have just had a newborn child, and the newborn child is sleeping with the parents, and this child who used to sleep with the parents has now been shifted to another room. That is when we see functional vision loss or malingering. And these are two most common scenarios that we have come across. Now, how do you test for it? It depends. Now, you sometimes cannot use the same methods that you would use in adults, because the child doesn't want to be told in front of the parent, or we should never tell the parent that your child is lying or acting or something, okay, because there is some reason behind it, there's some stress or something behind it. So one thing to do is tell the parents that, tell the child that I tested your eye, now I'll test your parents eye. You can sit outside for some time and just pretend you're examining the parents eye. That's the first step. Second thing you can do is actually take your stereo acuity book and tell the child, I'm going to show you some magic. I'm going to do some magic. Put those glasses on, those 3D glasses on, Polaroid glasses on, give them the stereo acuity book and check the stereo acuity. Most of the times you'll see that the child's stereo acuity is 70 seconds of arc or better, but what he'll be reading is 20/100 only. So if you have 40 seconds or 70 seconds of arc stereo acuity, that means it's absolutely fine. The vision is absolutely good. Second method you can use very commonly in children is fogging method. So sometimes what happens is children will come because they've seen some classmate wearing glasses. They also want glasses. So you can do fogging method. You can tell them that I'm going to give you a very nice pair of spectacles, but I need to check your power before that. So before checking, they would have read just 2400 or 2800 or something like that. So what you do is take a plus 15 diopter lens, put in front of one eye, and tell them, see, now you cannot see. Now I'm going to put one more lens. You'll be able to see. And in front of the other eye, just put a 0.25 plus 0.25. That 2800, immediately he'll start reading 20, 30, 20, 40, 20, 20. So this fogging method is another method you can do to check. So lot of tests for malingering are there. It's any standard textbook will give you, but you should know which to use in adults, which to use in children. Very important in children that you don't make them look, or you don't tell them that I know you're lying, you're able to see. Never make that statement. It can really affect them profoundly. And don't tell the parent also that your child is acting or something. Just ask the parent whether the child is being bullied in school. Is there something at home which is disturbing the child? Arrival of a new baby, maybe the child has some separation anxiety because of which it's doing this, wants attention. So all these factors might be there. These are two simple tests you can do to check for functional vision loss.
Okay, thank you so much, Dr. Akshay, for your answers. I guess we have answered almost all the questions till now. So, considering the time limits, here I announce the closure of discussion session. I would again like to express my immense gratitude towards Dr. Akshay for his wonderful insights and to all the attendees for their endurance. Also, I would like to thank all the direct and indirect helping hands for the iTalks program. Before wrap up, I request our today's presenter, Dr. Akshay, to share his few words to our program.
Yeah, thank you very much. I really appreciate the opportunity that you people handed to me to speak here. I really appreciate that. And I think the way you people were in touch just to make sure that I would be very comfortable while giving my talk, that I would be able to share my screen and not have any technological difficulties was really nice. Very happy. And I think what you people are doing is very good. I think continuing education during these difficult times, during corona, the pandemic is going on, we all know it. Despite all that, the fact that you're making efforts, going out of your way to teach young optometrists, young students, is very, very nice. So congratulations, I'm very happy to see this. Keep it up.
Thank you so much, Dr. Akshay. It's our immense pleasure to have you with us today, and we would love to see you again in the future.
Definitely. Thank you very much.
Herewith, I announce the closure of today's webinar, hoping to see you all again tomorrow. Stay safe.